If you're over 60 and feeling like your sexual confidence has disappeared, you're not alone. But what most men don't realize is that sexual confidence loss happens in three distinct stages, each with different causes and different solutions. Understanding which level you're experiencing is the key to rebuilding your confidence and reclaiming your sexual vitality. I'm Dr. James Whittaker, and today I'm breaking down the three levels of sexual confidence loss that affect men after 60, why each level occurs, and most importantly, the specific strategies that can restore your confidence at each stage. Understanding sexual confidence. Losing our after 60, sexual confidence isn't just about performance. It's about feeling comfortable, capable, and worthy as a sexual being. After 60, various physical, psychological, and social factors can erode this confidence, often in predictable stages that build upon each other. The tragedy is that many men experience this loss as an inevitable part of aging and simply accept it, withdrawing from sexual activity entirely. But sexual confidence loss after 60 isn't inevitable, and each level can be addressed with the right understanding and approach. What makes this particularly challenging is that sexual confidence affects every aspect of intimate relationships. When confidence declines, it impacts not just sexual frequency, but also emotional intimacy, communication, and overall relationship satisfaction. The good news is that sexual confidence can be rebuilt at any age. Men in their 70s, 80s, and beyond can experience renewed sexual confidence when they understand what's happening and take appropriate action. Level 1. Performance anxiety and physical changes. The first level of sexual confidence loss typically begins in the late 50s or early 60s and centers around performance anxiety triggered by physical changes. This is often where the confidence erosion begins, and if not addressed, it can progress to deeper levels. Level 1 is characterized by worry about sexual performance, concern about physical changes, self-consciousness about body changes, and beginning to avoid sexual situations due to anxiety. The physical changes that trigger level 1 confidence loss include slower arousal response, erections that aren't as firm as they used to be, reduced stamina and energy, changes in orgasm intensity, and longer recovery time between sexual encounters. These changes are normal aspects of aging, but they often catch men by surprise because no one prepares them for what to expect. When a man notices that his erections take longer to develop or aren't quite as rigid, his first response is often panic and self-doubt. Performance anxiety then creates a vicious cycle. Worry about performance actually makes performance worse by triggering stress hormones that restrict blood flow and interfere with arousal. This leads to more worry, creating an escalating cycle of anxiety and declining performance. Level 1 confidence loss is often accompanied by overthinking during sexual encounters, monitoring performance instead of enjoying the experience, and beginning to make excuses to avoid sexual situations. The psychological impact includes increased self-consciousness, comparing current performance to younger years, and fear that partners will notice changes or become dissatisfied. What makes level 1 particularly treatable is that the underlying physical health is often still good. The primary issue is psychological, learning to accept normal changes and adapt sexual expectations and techniques. Level 2, relationship and communication. Breakdown. Level 2, confidence loss occurs when the performance anxiety and avoidance from level 1 begin to affect relationship dynamics and communication. This typically develops 6 months to 2 years after level 1 begins, if not addressed. Level 2 is characterized by avoiding intimate conversations, declining frequency of sexual activity, increasing emotional distance from partner, and beginning to question overall attractiveness and desirability. The relationship breakdown in level 2 often begins with decreased communication about sex and intimacy. Men struggling with confidence often stop talking to their partners about their concerns, creating distance and misunderstanding. Partners may interpret the withdrawal as rejection or loss of attraction, leading to their own confidence issues and relationship insecurity. This creates a negative feedback loop where both partners become increasingly insecure and distant. Sexual frequency typically drops significantly during level 2 as avoidance becomes the primary coping strategy. What started as occasional performance concerns becomes systematic avoidance of sexual situations entirely. The emotional intimacy that forms the foundation of sexual confidence begins to erode. Men in level 2 often report feeling disconnected from their partners, even outside of sexual contexts. Self-worth and identity issues emerge during level 2. Many men derive significant self-worth from their role as sexual partners, and when this feels threatened, it affects confidence in other areas of life. Level 2 often includes increased focus on partners' responses and satisfaction, with men becoming hyper-vigilant about signs of disappointment or dissatisfaction from their partners. The tragedy of level 2 is that many relationship problems that develop during this stage are based on miscommunication and assumptions rather than actual dissatisfaction. Partners often remain loving and accepting, but the man's confidence loss creates barriers to intimacy. Level 3, complete sexual identity crisis. Level 3 represents the most severe form of sexual confidence loss, where men begin to question their entire sexual identity and consider themselves no longer sexual beings. This typically develops 1 to 3 years after level 2 if not addressed. Level 3 is characterized by complete avoidance of sexual activity, feeling like a sexual failure, questioning masculine identity, and sometimes considering the end of sexual life entirely. Men in level 3 often report feeling like they've lost their masculinity entirely. Sexual function becomes so tied to male identity that when it feels compromised, it creates an existential crisis about what it means to be a man. The complete withdrawal from sexual activity in level 3 often extends to all forms of physical intimacy. Men may avoid kissing, cuddling, and even casual physical affection because it might lead to expectations of sexual activity. Depression and anxiety often accompany level 3 confidence loss. The combination of relationship problems, identity crisis, and social isolation can trigger serious mental health issues that compound the original problems. Level 3 frequently includes self-sabotaging behaviors, where men push partners away or create conflicts to justify their sexual withdrawal. This protects them from facing their fears, but destroys the relationships they value most. The social isolation in level 3 often extends beyond romantic relationships. Men may withdraw from social situations, hobbies, and activities where discussions of sexuality or masculinity might arise. Some men in level 3 consider their sexual lives completely over and begin to structure their lives around this assumption, making major life changes based on the belief that they're no longer capable of sexual relationships. Please take a moment to hit that subscribe button and ring the notification bell. The sexual confidence restoration strategies I'm sharing today could transform your intimate relationships and overall quality of life. But YouTube doesn't always show my videos to everyone who needs them. Subscribing ensures you never miss these life-changing insights. The root causes behind each level. Understanding what drives each level of confidence loss is crucial for developing effective solutions. Level 1 is primarily driven by unrealistic expectations and lack of education about normal aging. Many men expect to function sexually at 70 exactly as they did at 30, and when reality doesn't match expectations, confidence suffers. The cultural emphasis on youthful sexuality and performance creates unrealistic standards that make normal age-related changes seem like failures. Media portrayals of sexuality rarely show realistic depictions of sex after 60. Medical conditions that become more common after 60, diabetes, heart disease, prostate problems, can contribute to physical changes that trigger level 1 confidence loss. Level 2 is driven by communication breakdown and relationship dynamics. When partners don't discuss changes openly, misunderstandings and assumptions create emotional distance that compounds confidence problems. Fear of partner judgment or disappointment often prevents the honest communication that could resolve many level 2 issues. Men often assume their partners are more concerned about performance than they actually are. Level 3 is driven by deep-seated beliefs about masculinity and self-worth that tie sexual function to male identity. Cultural messages that equate sexual performance with masculine value create vulnerability to identity crisis when function changes. The accumulation of disappointments and failed attempts at sexual activity can create learned helplessness, where men believe they're incapable of sexual success, regardless of circumstances. Education about normal aging and sexual function helps men understand that changes are normal and don't represent failure or disease. Learning what to expect removes the shock and panic that often trigger confidence loss. Expectation adjustment involves redefining sexual success beyond just firm erections and athletic performance. Sexual satisfaction and intimacy can actually improve with age when couples focus on quality over quantity. Performance anxiety management includes relaxation techniques, mindfulness practices, and learning to focus on pleasure rather than performance during sexual encounters. Physical health optimization can often improve function enough to restore confidence. This includes cardiovascular exercise, healthy diet, stress management, and addressing any medical conditions affecting sexual function. Communication with partners is crucial even at level 1. Sharing concerns and changes openly prevents the misunderstandings that lead to level 2 problems. Technique adaptation involves learning new approaches to sexuality that work with age-related changes rather than fighting against them. This might include longer foreplay, different positions, or focusing more on sensual pleasure. Rebuilding confidence at level 2. Level 2 requires more intensive relationship work and communication repair in addition to the level 1 strategies. Professional counseling, either individual or couples therapy, is often necessary to address the relationship dynamics and communication patterns that develop during level 2. Structured communication exercises help couples learn to discuss sexuality and intimacy openly without judgment or defensiveness. Many couples need guidance on how to have these conversations productively. Rebuilding emotional intimacy outside the bedroom is crucial for restoring sexual confidence. This includes increasing non-sexual physical affection, quality time together, and emotional sharing. Partner education helps partners understand what their loved one is experiencing and how they can be supportive rather than adding to the pressure. Gradual reintroduction to intimacy often works better than attempting to resume full sexual activity immediately. Starting with sensual massage, cuddling, and other forms of physical intimacy can rebuild comfort and confidence. Rebuilding confidence at level 3. Level 3 requires the most comprehensive approach, often including professional help and significant lifestyle changes. Mental health treatment is usually necessary to address the depression, anxiety, and identity issues that characterize level 3. This might include therapy, medication, or both. Identity work involves separating self-worth from sexual performance and developing a broader, more resilient sense of masculinity and value as a person. Social reconnection helps counter the isolation that often accompanies level 3. This might involve reconnecting with friends, pursuing hobbies, or engaging in community activities. Medical evaluation is crucial to rule out or treat any underlying health conditions that might be contributing to sexual problems. Sometimes addressing medical issues can provide the confidence boost needed to begin recovery. I'd love to hear from you in the comments below. Which level of confidence loss resonates most with your experience? And what steps have you taken to address these challenges? Your story could help other men in our community understand they're not alone in this journey. Recovery from sexual confidence loss takes time, and understanding realistic timelines helps maintain motivation and track progress. Level 1 recovery typically takes 3 to 6 months with consistent effort. The combination of education, expectation adjustment, and anxiety management can restore confidence relatively quickly when the underlying relationship is healthy. Level 2 recovery usually takes 6 months to 2 years, depending on how long the communication and relationship problems have been developing. Rebuilding trust and intimacy takes time, but most couples can recover with proper effort. Level 3. Recovery is the most variable, taking anywhere from 1 to several years. The depth of the identity crisis and associated mental health issues affects the timeline significantly. The key principle across all levels is that recovery is possible at any age. Men in their 70s and 80s have successfully rebuilt sexual confidence when they understand the process and commit to the necessary changes. Progress isn't always linear. Setbacks and plateaus are normal parts of recovery, and patience with the process is essential for long-term success. The best approach is preventing confidence loss from progressing through the levels or occurring in the first place. Open communication about sexuality and aging should begin before problems develop. Couples who discuss changes and expectations proactively are less likely to experience severe confidence loss. Regular health maintenance, including exercise, good nutrition, stress management, and medical care, can prevent many of the physical changes that trigger confidence. Problems. Realistic expectations about aging and sexuality, developed through education and communication, prevent the shock and panic that often start the confidence loss cycle. Maintaining overall life satisfaction and self-worth that isn't dependent on sexual performance creates resilience against confidence loss when changes occur. Start by honestly assessing which level of confidence loss you're experiencing. This determines which strategies and interventions will be most helpful. If you're at level 1, focus on education, expectation adjustment, and performance anxiety management. Consider speaking with a healthcare provider about any physical concerns. If you're at level 2, prioritize communication and relationship repair. Professional counseling can be invaluable for breaking negative cycles and rebuilding intimacy. If you're at level 3, seek professional mental health support immediately. The identity crisis and depression that characterize this level often require professional intervention. Regardless of level, remember that recovery is possible and you don't have to navigate this alone. Support from healthcare providers, counselors, support groups, or trusted friends can make a significant difference. Most importantly, don't give up on your sexual life. Sexual intimacy and confidence can be rebuilt at any age with the right understanding, approach, and support. Your sexual story doesn't have to end at 60. It can be transformed into something even more meaningful and satisfying than what you experienced in your younger years.